Welcome back to the Doc Talk podcast. I'm Dr. Sheila Wijayasinghe, a family doctor in Toronto.
And I'm Dr. Shazma Mathani, an ER doctor in Edmonton. And a special thank you to today's episode sponsor, FIGS. So obviously in our line of work, you kind of live in scrubs. And if you follow us on Instagram, you probably already know this by now, but we are obsessed with FIGS scrubs. They're super comfortable, breathable, durable, and they actually fit well, which is, for me, a massive upgrade from those horrible itchy scrubs that were status quo in the hospital for so long. They're super cute and stylish, and they just feel good when you're in them, you know?
Yeah, totally, Shaz. Like you said, we're obsessed with them. But you know what I love most about FIGS is that they just get what it's like to work in this field. It's not just that they know what we need, like 7 pants pockets to carry all our stuff around on shift. They've also built this incredibly supportive community of people who want to have important discussions and make real connections with other people who work in healthcare. I've been to a couple of events they've done, and it's so refreshing for a brand to show up in such a real way. And you guys, if you're not following them on social media, the memes. They are very funny and very relatable. If you work in healthcare or know someone who does, FIGS is it. And right now, if you go to wearfigs.com and use code FIGSCA, that's FIGSCA, you can get 20% off your first order. That's wearfigs.com, code FIGSCA. And so I'm really excited about today, Shaz, because last season, in season 1, we had a really popular episode called Avoiding the Emergency Room or Avoiding the ER. And that part 1 was about kids, because you are a pediatric emergency doctor, but you're also an adult emergency doctor. And we had so much feedback from you, our listeners, wanting to hear about what does Dr. Shaz suggest about how you stay out of the emergency room? And so please check out our season 1 episode, Avoiding the ER for Kids. But now we are going to be tackling how to avoid the emergency room as an adult.
Yeah. And I mean, so myself as an ER doctor, I work in a pediatric emerge. Like you said, I work in an adult emerge as well. And over the last several years, we've just been seeing constantly growing wait times across the entire country in the ER, sometimes in excess of 10, 15 hours in some places. And I think that in an episode like this, and even just the emerge in general, is something that affects everybody. So, when I see people that have been waiting a long time, and especially when it's someone that I end up sending home, they require some reassurance, and, they maybe get 1 or 2 investigations, if at all, and they end up going home with some reassurance, I can see their faces drop, and the frustration of having to wait for hours and hours and hours just to be told, hey, you're okay, you can go home. I get that. I feel that every single day. And I try, my best in the moments to reframe it as, it is good news. It is very much good news that you don't have to be admitted and you don't have anything bad, but that's a big chunk of people's lives and people's days that are happening, while they're waiting in the ER. So I think this is a really important topic that's going to affect a lot of our listeners.
Absolutely. So what we wanted to do first, is talk about when should you actually go to the emergency room and what scenarios warrant that. Yes, think about it, call that 911 or go straight to the emerge, because that's a really big question that people may have and may delay care in a way because they're not sure if they should be going in or not. So when should you actually go to the emerge?
So I'm going to start head to toe, just so I don't miss anything. So when we talk about the head, if you have a severe kind of sudden onset headache or a headache that's getting worse or changing, you should come to the emerge. When we talk about the brain as well, any sort of stroke-like symptoms. So if you start noticing any difficulty with speaking, any weakness or numbness to one side of your body, that's another reason to come in. The eyeballs, any vision loss. So I work at an ophthalmological center, an eye center. And so all of our eye emergencies come in. So any sort of trauma or changes to the vision, you got to come in if they're acute changes. Chest pain, shortness of breath, we worry about things like heart attacks, blood clots, pneumonias, heart failure, all these sorts of things in the chest. When it comes to the abdomen, severe abdominal pain, unrelenting vomiting or diarrhea that isn't getting better, any blood in your vomit, any blood in your stool, these are reasons to come into the ER. And then we get to the extremities and the limbs, broken bones, big cuts that you think might need stitches. And then I always have a disclaimer or kind of a catch-all. If you're worried and you can't have access or you don't have access to a doctor and you feel you need to be seen, you're worried about something, then please come in. It's always better to be able to provide reassurance than find out that somebody delayed coming in or didn't come in when they thought that they should have and then end up having something get missed.
Oh, that's super helpful because, as a family doctor, often we'd like to see people before they go to the emerge so that we can give that guidance. But this is super helpful in case you aren't able to reach your family doctor's office or your nurse practitioner. Now, You also see the other side of this. Now, when shouldn't someone go to the emergency room? Those people that you mentioned, like that are waiting a long time, and they're going to be triaged in the sense of like prioritized as low priority, because maybe these are things that could be managed by your family doctor instead of being seen in an acute emergency room setting. So when shouldn't someone go to the emerge?
Yeah. And so these are, again, like you said, things that you were going to be able to manage as a family doctor in your office setting. And so things that I commonly see, so things like common colds, like cough or colds, sore throats, runny nose, earaches or ear pain in pediatric or adult patients. These are things that could very much be managed in the outpatient setting, not in an emergency setting. Things like prescription renewals. So there are lots of patients without a primary care provider, but these are things that could be renewed, especially if it's a medication that you've been on for a long time, by prescribing pharmacists, depending on what province you're in, by a walk-in clinic, by like even a virtual clinic or telemedicine for a prescription you've been on for a long time. Any sort of ongoing chronic pain that's at the same level that it's been at with no kind of new changes or red flags. Again, these are things that can be managed as an outpatient by your primary care provider. So those are kind of the big things that come to mind immediately in terms of things that I see pretty commonly that end up getting kind of a quick reassurance after waiting typically many, many hours, but could have been seen by a family doctor in the community instead.
That's great. So like just as a quick overview, there's great urgent care options for those non-acute issues. Telemedicine is really helpful. I know in Ontario, we have that across different provinces. And then calling your family doctor for assistance. If it's something that can wait, it's better to avoid having to go in, right?
Yeah, because the other thing is like, not only is it like it takes your time, right? You're waiting there for hours, but it's also an exposure to things, right? So if you're sitting in a waiting room, especially as we have, the fall and winter coming up with respiratory virus season, you're sitting there in a waiting room that's crowded full of people. You're also prone to catching things when you're waiting there too. So there's a few reasons to avoid having to go to the ER unless you absolutely have to.
Absolutely. So let's get into some of the things that you're seeing in the emergency room and how to avoid those things when you're at home. And first off, one of the things are like those preventable injuries that you can get in your home when you're cooking, when you're cleaning, all of those things. And one of the things that I hear about a lot are avocado injuries. So tell me, have you seen this a lot? I've seen it in my office, but most I think people go to the emerge.
Yeah. So if you think about how when you're like cutting an avocado or something, even like a bagel, you hold it in your hand and then you take the knife and you cut it towards your palm. And so all it takes is one slip of typically a sharp knife, like a bread knife if you're cutting a bagel, or, a chopping knife or like a slicing knife if you're cutting an avocado. Like these are typically sharp knives. And so one slip and it can slice your palm pretty easily. So I have very much seen knife and kitchen injuries, whether it be from cutting something in your palm, oftentimes fingertips. So chefs or even at-home chefs, when they're chopping something really quickly, they lose their attention. Lots of fingertip kind of avulsions, or like where they cut the entire end of their finger off with a knife. So these are like these kitchen injuries. And a mandolin is another common one, right? Yes. So like I am terrified of mandolins. Like we have one at home. We use it. It comes with a glove. Use the glove, because like that is a super, super sharp blade. And that's another thing that can really just take like a slice off the edge of your thumb or your finger or, your fingertips because of that sharp blade as you're cutting the vegetable or fruit or whatever you're cutting. So that's another common one that I see in terms of like sharp object kitchen injuries. That's
a big one. Whenever the kids are around me in the kitchen, I'm always like, no one around me right now. Like, especially if there's an avocado or bagel in the mix, because you know that's like, you can be distracted very easily by kids or a dog or something. And you just can, so really like flat surface, sharp knife, take your time, and no like multitasking,
pay attention. No multitasking, pay attention. 100%. So my daughter, she's 9 and she loves to be around in the kitchen with my husband while he's like preparing and making dinner. And she's great. She's like very good. And she like when she has our really, like we have like this one super sharp Japanese knife, and when she's cutting with that, and she'll just be like chit-chatting. And I'm like, no, you need to pay attention, look down, go slowly, pay attention to what you're doing, because I don't want to have to take you to the emerge to see my friends because of your finger laceration.
I mean, Shaz, I think our kids get like the worst stories because I go directly to 100% with them. I'm like, I've seen this happen. Put like focus on what you're doing. Like we go from 0 to 100 on our advice, but this is what we want for our listeners to also know, because we don't want to see you get injured. And these are things that you can take that extra couple of minutes and protect yourself. One of the other things,
I feel like I walk through the world just seeing injuries around.
Oh yes, of course. Yeah, that's kind of what we do
because of what we see at work.
Because that's what we see, and that's what we'd like to protect others for. The other big injury that I think I see sometimes in my office, but again, usually goes direct to the emerge, are things like falls and injuries in the wintertime. Growing up in Edmonton, I know when we're running out just to throw the garbage outside, I'd throw on some flip-flops and run out into the slippery, like Crocs are really popular right now. And I think that's like a big injury piece.
So the number of like slips and falls that I see that are footwear specific in the winter time is pretty significant. And what ends up happening is like if you don't have a good closed toe with a good grippy sole when you're out and about, like especially in the shoulder parts of winter, like as there's like hot and cold and things are melting and it's super icy. Like these are things that can like change even just throughout the day, whether there's like sun on a spot or not. And these are injuries that we see quite often. So people slip, they fall on, if it's, an older individual, they fall onto their hip and they have a broken hip. They land forward onto their outstretched hands, what we call a foosh injury. So fall on outstretched hand. And that leads to wrist fractures. Rolling your ankle leads to like ankle fractures. Somebody falls on their buttocks, they can have like tailbone fractures or vertebrae compression fractures. So lots of different injuries, all typically bony. Of course, head injuries as well. You fall, you slip back, and you land on the back of your head on a hard surface. Like we've seen brain bleeds, severe concussions with these as well, cuts to the back of the head that require stitches. So these are all injuries that are kind of part and parcel of not inadequate footwear in the wintertime in the slippery season. So it's really important to wear something with a good sole that is like a supportive sole that has good grip on it as well, because these are things that can lead to significant injuries. When I'm out and about, if I'm running in the winter, even if I'm walking my dog in the winter, you can get these ice cleats that you can just like, they're these like rubber things that you can just put onto the bottom of your shoe that have these little titanium nubs on them that like dig into the ice, or there's some that have metal coils as well that dig into the ice, and these provide really, really good grip. And so you can throw those onto your existing shoe. You can get, they're very affordable in many different places, like kind of under 15 or $20. And these are ones, these last several seasons and can really help protect your fall risk or improve your fall risk.
Yeah, I sent some of those to my parents when they lived in Edmonton because I was nervous every time there. I could hear that the weather would change. And so that gave me some reassurance. I don't think that they use them, but it was, I felt good about sending them. But they're here now, so there's less ice, but still something that I think about. Now, I want to shift a little bit towards still preventative and injury-based sort of things that you're seeing in the emerge. And this is a topic that we actually talked about last year quite a bit in our episode on how to avoid the emerge for kids, but trampolines. I know this is one of your favorite ones. So tell me about trampolines and why you don't like them for adults.
Favorite or least favorite? It depends on what angle we're taking. So trampolines are, especially trampoline parks, are high potential injury situations in not only kids, which we talked about in our episode last season, but in adults too, like teenagers and older adults. So the problem with this is let's say even in like a backyard trampoline, you're jumping with another adult, you get double bounced. Your knees. The first thing that's going to happen is that your knee's going to buckle. That's at risk of either having a fracture or like something like an ACL injury. I've seen people fall off trampolines or collide with other people on trampolines and have limb injuries like broken bones to their arms or their legs. And then head injuries, like you're in close proximity with people that are bouncing at pretty like high velocities with not a lot of control when you're up in the air, right? Like a bad bounce can cause you colliding with another individual, and skulls are hard. And they can really lead to significant head injuries, like concussions or even brain bleeds, cuts or lacerations, fractures. And then, of course, in these trampoline parks, there have been, unfortunately, stories that we've seen in Canada of people who have taken a dive into foam pits or fallen and sustained C-spine injuries and spinal cord injuries. And then this is something that is completely life-changing for an individual because it then can cause either paraplegia or quadriplegia, depending on the level of the injury. And so these are all injuries that I have seen or my colleagues have seen as a result of trampolines. And so these are potentially high injury situations for sure.
Okay. And so since we're on the topic of falls and injuries, I just want to make a quick note as a family doc, we did an episode last season also on osteoporosis or bone health and how to take care. So I encourage you to take a listen to that, share that episode, because that's a topic we don't talk about enough. And the issue with the falls that you've mentioned, Shaz, in terms of the slip and falls or the wintertime falls or falling off a trampoline, is that if your bone density is low, you have a higher risk of sustaining a hip fracture or injury that can have very high morbidity, meaning like injury and like the effect on your well-being in your life, but also mortality, and the death rate goes up with hip fractures. And so we're not trying to put a morbid spin on this, but we do want you to avoid getting that. So take a listen to that episode as well, just to strengthen your bones in case you do have a slip and fall injury, to protect yourself as much as possible. Falls do happen, but we want to protect you as much as possible from them happening in the first place.
Yeah, absolutely. And I mean, like the drop in bone density happens earlier than you think as well. It's really important to go back and listen to that episode, because small changes can certainly make a big impact. And especially during those icy months, falls are a big, big reason that people end up coming into the ER and getting hospitalized.
For sure. So we can't talk about like avoidable ER visits without talking about some basic safety issues. So things like drinking and driving, seatbelt safety, helmets, and even drowning. So Shaz, this is something I think that you see all too often, unfortunately. So can you take us through a little bit about these areas?
Yeah. So, I mean, we're kind of just wrapping up the summer. Every summer, there are cases in all age groups. And even, the assumption often is that because you're an adult, you don't have to worry about the water, you know how to swim. But there are many situations where adults end up losing their lives being in the water and drowning. And a lot of times it's either related to substances like alcohol. So you've been like spending the day at the lake, you've been, drinking beers throughout the day or beverages throughout the day, and then you take a dip in the water, something happens. And, we've talked about this previously on our, like how to keep kids out of the ER as well. Like drowning is silent. It is not something that is like dramatized the way that we see it on TV. It is often silent, and it can happen very quickly and quietly. Another situation, like I mentioned, is adults tend to overestimate their ability to swim and end up then in situations that are uncomfortable and then potentially dangerous. And so I think for drowning in particular, it's important to remind our listeners that drowning is not just a childhood issue. It's an adult issue as well. It's important to wear a life jacket, always swim with somebody, never alone, and avoid any substances near the water.
Yeah, the same thing holds true for, when we're talking about accidents. Tell me a little bit more about like seatbelts, because I assume that seatbelts are used very regularly. It's sort of like an automatic. You get in the car. I mean, cars sometimes now have these automatic warnings that come on just to kind of say that we can't go without you having your seatbelt on. But Are you still seeing seatbelt related accidents, or like people not wearing their seatbelts?
Yeah, and often related to substances as well, like drinking and driving. A seatbelt holds you basically from being ejected out of your vehicle. So if you can imagine, if you're going at even like above 60 kilometers an hour, that's like if you are a flying projectile at that speed out of your windshield and onto the road in front of you, that's a very, very high impact injury that is absolutely life-threatening and can cause death. And so seatbelts basically are they keep you in the vehicle when you crash, and they keep you from going through the windshield and flying out onto the pavement in front of you. And these are like life-threatening injuries that people sustain. And so when I see people have been ejected from vehicles because they're not wearing their seatbelt, significant head injuries, often patients, again, not to get too morbid or to scare people, but these are patients that are what we kind of say, quote unquote, black on scene. So they are dead immediately on scene because their injuries are so significant and so devastating that they're unsurvivable immediately. And these are always patients who unfortunately are not wearing seatbelts. And so it's really, really important to it's just such a simple thing. And thankfully, like you said, Sheila, with like newer vehicles, the dinger doesn't shut up until you put your seatbelt on. So, so that's an important one. And then, of course, helmets are, what I always tell my kids is you only have one brain, so you have to protect it. So whether that's biking, on an e-scooter if you're deciding to get on one, but I recommend not getting on one at all. Snow sports like skiing or snowboarding, skateboarding, rollerblading, like all of tobogganing. So with winter coming up soon, when I go sledding with my kids, I put my helmet, I basically just use my ski helmet because it's warm. Yeah. But these are all things where just it takes 1 second to have a significant head injury that can be life-changing.
Yeah. And I think what I see in my office is often concussion injuries. And that is something that's has such a devastating impact on people's lives and well-being. And it's undertreated, and because it's invisible and people aren't able to function. They're not able to do their normal, usual routines. And so it's not just the acute injuries that you're seeing in the emerge, Shaz, around like head injuries. It's also what we're seeing in family practice. The impact is long-standing.
Yeah. And these are things that are like life-altering. Like I've seen patients and even know some friends that like basically their entire career trajectory has been changed after a head injury. And they can't work in the same capacity they used to before. So these are things that we kind of just, when you hear about concussions in the sports world, it's very much like brushed off and not taken seriously, but these are life-altering injuries.
Yeah, for sure. So tell me one thing around alcohol use and driving, since we're on the topic of driving and head injuries and otherwise. Again, something that I think I make an assumption sometimes that we're not seeing that as much, that people aren't drinking and driving in the same ways that maybe when we were younger but you are seeing that as well, I imagine.
Yeah. I mean, as much as I would like to, it sounds so simple and so basic, but like, don't drink and drive, don't use substances and drive, like whatever the substance is, because these are things that are going to impact your ability to use your brain properly and react in a way that is appropriate, or, operate this vehicle in a way that is safe and appropriate. So yeah, just don't drink and drive. I can't even tell you, I'm like, it's disappointing that we still see, I in the emerge, still see so many people come in after having been victims of, drinking and driving collisions. And these are injuries that are often quite devastating and are 100% preventable.
Mm-hmm. I want to bring out something a little bit gently around opioids and overdose. It's something that we're seeing more and more across Canada, and it affects people of all backgrounds. I'm sure, Shaz, that you're seeing it in your office. We see it in our offices as well. If you or someone that you know is prescribed opioids or uses substances, it's not a moral issue. This is like a health-related issue, and having naloxone or Narcan on hand can save a life. And it's available at most pharmacies. It's free. It's something just to have it. I have it in my pocket that when I'm traveling anywhere and walking around the city, I have naloxone with me. I have it in the car. It's just something when you see this, and it's life-saving if you have it on hand. And Chaz, I'm sure you've seen the side of this as well.
Yeah, thanks so much for bringing that up. I mean, with working in an intercity ER, I see patients who come in with opioid poisonings multiple times a day. I have naloxone in my work bag. I have naloxone in my bike bag. In my car, we have one in our home, and I have one I put one in my husband's work bag as well. Just because you never know when you're going to run into a situation where you might need to use it. It is safe, easy, it's free, like you said, and it is absolutely life-saving. And so this is like harm reduction and preventative health, right? It's the same way that drinking alcohol in a bar is harm reduction, because you're around people when you're using a substance. And I think there's a lot of stigma around opioids in particular, because it is, not a regulated drug right now. It is illegal, but we have lots of situations where we have regulated and legal drugs that are also used in safe settings, like a bar, for example, for alcohol. And so having naloxone on hand is life-saving. And again, it is, just mitigating harm that can occur with substance use.
Mm-hmm. So the next part that we want to talk about is actually very close to my heart, because as a family doctor, a lot of what we do in primary care is around prevention. So I'm working with my patients before they get ill, before they have a heart attack, we're managing their blood pressure. Before they get that diabetic complication, we're managing their blood sugar. And so prevention is such a big part of avoiding the emergency room. And that's something that I don't think we talk about enough, but Shaz, you and I talk about it all the time. How does primary care, as an emerge physician, from your perspective, how does that keep people out of the emergency room?
Oh, if everybody had access to a family doctor that they could see when they needed to see them, we would see a significant drop in emergency department visits. I mean, you've heard me say this before, family medicine is the foundation of the healthcare system because of the amount of prevention that takes place, the saying about an ounce of prevention, right? And so things like heart attacks, preventable. if you have a family doctor where you're working on lifestyle changes with them, having your cholesterol and blood pressure under control. Strokes, again, in the same category. Seeing your family doctor regularly, keeping your blood pressure under control. Blood pressure is not an acute thing that can cause, typically causes acute issues. It's over time and years. The strain on the blood vessels is what can cause strokes and heart attacks. Diabetes as well. So patients who are often not able to afford their medications or don't have access to primary care to keep their blood sugar under control end up having complications of this. Of course, vaccinations are huge as well. So, we're seeing a rise in measles cases across the country right now with complications of this, things with respiratory season coming up, influenza, COVID, for older individuals, the pneumonia vaccine, the shingles vaccine. These are all reasons that people end up coming to the ER, and we have vaccines that will prevent these illnesses.
And along the same lines with vaccinations, don't forget about the cancer screening too, right? Mm-hmm. Those are things that you see in later stages of cancer presenting to the emergency room. But doing your routine screening for things like Pap testing or HPV testing for cervical cancer screening, doing your mammograms, your colonoscopies, or your fecal occult blood test, which we did a cancer screening episode as well last season to chat a little bit about what screening tests you need. Check that out. I encourage you to book your appointment if you have a family doctor. Walk-in clinics can also do these things for you if you don't have a family doctor. We know that there's a primary care crisis right now in Canada where over 6 million Canadians don't have a family doctor, but you can still get access to vaccinations and screening. And these are things that are going to protect you down the road. And early detection, we know, can save lives. And it also means less trips to the emergency room as a result.
So I want to flip things around a little bit because, Sheila, we've talked about all the things that I see in the ER and, things that I wish people knew, but a lot of, we just talked about prevention. A lot of these things happen in your office with your patients. So I want to kind of flip it and talk about lifestyle and preventative lifestyle changes. So what are things that you talk to your patients about that you wish all of our listeners knew so that they didn't have to come in and see me in the ER?
Yeah, this is what I do. I love talking about lifestyle with my patients, and it always reminds me also to incorporate those lifestyle changes in my own life and my loved ones' lives as well. But we go back to the basics with my patients. We talk about sleep a lot. Like sleep is something that many of us are underslept. We're not getting that full sleep. Again, we have an episode on sleep, actually. We have many episodes, actually, that we're hitting today, Shaz, with this. We had a wonderful expert on talking about sleep, and that was one of our most listened to episodes as well. So sleep, how do you sleep? And I encourage everyone to listen to that. Hydrating well, so getting enough fluid intake, whether that's water or tea, whatever it is, those are ways to protect your body, kidney, keep you energized, keep that energy up to reduce that risk of injuries and otherwise. That's also part of that, getting the good sleep and hydration. Eating a good healthy meal is important as well, and managing your stress levels make a huge difference. So often with my patients, I'm talking about things like mindfulness. How do we work together? Food is expensive, so if we work on finding ways to find healthy options at decent price points. So we do a lot of these sorts of things within our family medicine offices. And I also see a lot of, in my office, I see complications related to substance use, which we touched upon earlier, like alcohol, smoking as well. And so those are things that we work very closely, and we have great programs that are in place to support people. You're not alone when it comes to things like alcohol use or smoking cessation. We have tools, we have medications, we have counseling supports that are available, and those things can all help keep you healthy, but also reduce the risk of those injuries as well, and the cancer risk as well. And finally, one of the things that I really want to touch upon, Shaz, that I think you also see a lot in the emerge is around mental health. So often people are left and they feel, especially post-pandemic, I think we all assume that after the pandemic that everyone would feel better and that our mental health crisis would lift. But actually, I think that it's gotten quite a bit worse after the pandemic. We've been isolated. People are struggling to connect. We're on our phones often. Social media isn't great for our brain. And we have an unmanaged mental health crisis that results in very significant anxiety and depression in many of our population. And that has its own impact. So getting that help before it becomes a crisis is important. Asking for that support, asking for the referral for counseling. There are services that are across different provinces that are free for counseling as well. And we're here to support you. And that's something that I encourage everyone to reach out. It's not just diet and exercise. It's also really focusing on mental health as well.
And I'll just kind of direct listeners to an episode that we had in season 1 with Dr. Jody Carrington on mental health and the loneliness epidemic. And so I would encourage listeners to go back and listen to that. We talk about a lot about it, and then things that you can incorporate into your daily life to help improve your mental health.
So before we get into our true or false segment, let's go over the red flags one more time, Shaz, because I think it's really helpful. It's helpful to me because when I hear you tell our listeners about what to look out for, it just reiterates for myself what I'm telling my patients as well. So what symptoms should always prompt a visit to the emergency room?
So a sudden and severe headache, any new neurologic symptoms, any changes to your vision, changes to your speech, chest pain or shortness of breath, severe abdominal pain, kind of unrelenting vomiting or diarrhea, blood in your vomit or stool, uncontrolled bleeding like gynecological bleeding, so vaginal bleeding, for example, any big cut that you feel like it's not stopping to bleed or think it needs stitches, or if there's a bone that doesn't look like it should, or lots of swelling around in like a limb, then certainly concerns for a broken bones. Those would be some important reasons to seek medical attention right away.
That's great, Jess. Thank you. So what we're going to do next is our lightning round of true or false. So I'm going to ask you questions and we're going to go back and forth here, Shaz. So true or false? If you think you're having a heart attack, you should drive yourself to the hospital.
False. So this is something that is a very legitimate reason to call 911, and that's because paramedics can actually start treatment for a heart attack right when they see you. So that includes getting an ECG to diagnose a heart attack, and if there is one, they can actually call a cardiologist on call and get different medications going as well. And so this can actually significantly improve your chance of having a good outcome. So please don't drive yourself, call 911 because it brings the professionals to you and then gets you to the right hospital.
And telling 911 that you think you may be having a heart attack
Yes.
is important because they'll send the paramedics who have that training to be able to manage and start managing it on the spot.
Mm-hmm. So true or false, if you wear a helmet, you're being overly cautious.
So false. Helmets save lives, full stop, like especially on bikes, e-scooters, or skiing or tobogganing or any of these activities that are like acceleration types of sports or high-speed sports. Really important. So definitely helmets save lives. It is not being overly cautious. True or false? You can't drown if you're a strong swimmer.
This is 100% false. So we know that there are drowning deaths in all levels of swimmer, even the strongest swimmer, especially when we factor in things like fatigue, cold water, alcohol. These all impact your ability. Even if you're, an Olympic swimmer or someone who is a very, very strong swimmer, you can still drown and have or have negative impacts in the water. So never swim alone, and certainly never overestimate your abilities, even if you are a strong swimmer. True or false? Vaccines help reduce ER visits.
So true. We know that vaccination for flu, pneumonia, shingles vaccine, COVID vaccines, they all are vaccines that prevent infections that often land people in the hospital every single year. And so really important. We have flu season coming up around the corner. If you're over 65, you're eligible for pneumonia vaccine, the shingles vaccine, and always think about the COVID vaccine because COVID is still around.
Mm-hmm.
True or false? Regular checkups with your doctor can help prevent emergency room visits.
This is absolutely true. So things like high blood pressure, high cholesterol, diabetes, and even things like cancer can actually all be detected early or prevented altogether and can make a massive difference in terms of whether you need emergency care. True or false? If your family doctor cannot see you today, going to the ER is your next best bet.
So false. So this is something that happens very often. And understandably, if you need to see your doctor and you want to see your doctor, you want to see them the same day. If it's not truly an emergency, please try telemedicine, urgent care, or pharmacy clinics. Pharmacists are prescribing now as well before. And I always tell my patients, if it's something that you're worried about, let the front staff know at your family doctor's office because we have space in our days built in to see our urgent care patients. That's our responsibility to you as our patient is to make sure that we're seeing you if there is something going on that needs to be seen within a day or two. So please do call and let us know before going to the emergency room because they are full and you'll likely have to wait a long time.
Mm-hmm. I tell that to patients as well. Like if I'm getting someone to follow up with their family doctor, patients don't often know that there are time slots that family doctors leave available for emergency situations or urgent situations. So I do kind of remind my patients of that when they're leaving the ER, and I want them to follow up with their family doctor as well.
Thank you for telling them that. That helps us a lot too. So we've covered for you when to go to the emergency room, when to stay home or seek care with your regular provider, how to prevent injuries, the things that you're seeing most often, Shaz, and how to lean into prevention. And so what we like to do after every episode is wrap up with a prescription for our listeners.
So my prescription as an ER doctor is, number one, to know your red flags. So know the things that you need to look out for to go into the ER. And then, of course, prevent what you can. So things like helmets, vaccines, seatbelts, how you use sharp knives in the kitchen. These are all things, trampoline parks. These are all things that, when thought about in, a thoughtful way, can lead to injury prevention and then prevent that emerge visit. And of course, please stay connected to your primary care team. Like I said, family medicine is worth its weight in gold. It is the foundation of our healthcare system, and it can really, over the long term, prevent the need for ER visits.
And so if you learned something today, please share this episode with a friend or family member. It might just help them save a trip to the emergency room.
And a reminder that the Doc Talk is for general information purposes only. This podcast is not intended to replace medical advice from your doctor. While we are doctors, we are not your doctor. Always speak to your own healthcare provider for questions related to your personal health needs. And of course, please be sure to follow us on social media at the Doc Talk Pod and send us your questions.